Today, I thought it'd be really good to answer some of the questions that regular and new clients often ask me. And some of these are caused by things that we see in social media, some are by other clients' concerns and their own worries. So I like to address any issues that clients may have and just make them feel really safe and reassured when they're making a choice in facial aesthetics. These days, we do have issues with things in the media about facial aesthetics, such as people's trout pout, duck lips, the things we see on Love Island and Towie, and sometimes it encourages patients to seek treatment, but other times it can actually put them off and make them worry that they're going to look unnatural, their friends are going to tell, and that people are going to laugh at them. So what I try and do with all my clients is really reassure them that all we'll be doing is working with their natural look, trying to aim to achieve the results that they would really like to achieve, and not give them any unnatural looks or any problems for the future with their facial aesthetics treatments. The first question I usually get asked by people is, will it hurt? Now, if you've not had aesthetics treatments before, the thought of being treated with a needle in your mouth or around the eye is always very scary. But we try and make the process as gentle and comfortable as possible. And as medical professionals, we're equipped to really help you deal with that. So we use numbing cream, which is really good and efficient. And we also use lidocaine injections sometimes for treatment. And as dental professionals, we can use dental blocks as well to really help, especially for lip treatment. But generally they're not needed unless you're very, very nervous. The numbing cream and the filler itself has lidocaine in it. So usually after the first couple of injections, things are actually really comfortable. And most patients say it can feel just a little sharp, or a little like a burning sensation, but it certainly never puts them off having treatment again in the future. It's usually the anticipation of the pain that's actually a lot worse, and most treatments are really pretty comfortable. And the majority of treatments are actually done in 5 or 10 minutes. Most of it is the talking, the numbing, speaking to you afterwards. The actual treatment itself is very quick and, like I say, usually relatively painless. One of the questions I also get asked is, will I be swollen or bruised? Sometimes people forget that they're going to have a treatment done and that there's always a risk of swelling or bruising and are going to an important event. So I always say, plan your treatments around events. Come and speak to me for a consultation and let me tell you how things will be afterwards so that you can plan your social life and your events all around it. It is normal to be a little bit swollen after treatments, possibly up to 2 weeks with some more invasive treatments, but generally it's just a couple of days, and swelling will go down quite quickly with the correct advice and the correct aftercare. Bruising is rare, but bruising can happen with treatments, and that's a normal part of the procedure. The face is covered in hundreds of tiny capillaries and other vessels, so it is normal that a bruise can occur. If it occurs, we can help you deal with that, and they can usually be covered by makeup in the majority of cases, so it's nothing to worry about. So people often worry with aesthetics treatments, particularly the lips. Will they look unnatural? Will people be able to tell? Will I look like I've had work done? Will I be frozen? Will I look ducky? These are all the questions I get asked. Good work should just make you look a little bit fresher, and people shouldn't be able to tell what's been done. They should look at you and think, oh, she looks well, or she looks like she's been on a holiday, but not quite know why, and that's the secret to really good treatments. People do want to look artificial, and that's also possible, but we'd really like to encourage you to work with your own natural beauty and enhance your characteristics, not make things look artificial. At the most, people might be able to tell for a few days if you're swollen, but particularly with Botox treatments, there's usually nothing to see afterwards. Also, as well, to keep things looking natural and that people can't tell, we like to build up treatments gradually. So as a first visit, I wouldn't say to you, you should have 5 or 6 syringes of filler, you should have lots of Botox. I would always say, let's do a small treatment to start with, see how you get on with it, particularly for lip treatments, because building them gradually is the key to getting a really good result as well. Something else people worry about is, what happens if I stop? People say, oh, my face is going to look different if I stop having treatments, it's going to be worse than before I started, everything's going to go downhill if I stop, I'm caught in having the treatments. Not at all. With most facial aesthetic treatments, there is no long-term lasting effects if treatments are done safely and professionally. Lip fillers will dissolve naturally with your body if you change your mind or you become pregnant and can't have treatments any longer, which is often something that I get asked. We never do treatments on people who are pregnant or breastfeeding, so that can be a time when you might have to pause your treatments for a while. Things like Botox, as the Botox is wearing off, you just gradually return to normal. So nothing looks unnatural. You don't wake up one day looking different. And studies have shown, and results with clients have shown over the years, that if you stop having Botox treatment, you just return to normal gradually. There isn't any lasting effect or any problems that should occur afterwards. If you change your mind or financially you're unable to carry on having treatments, everything should be fine. And I always say, ask me about that at a consultation and we can tell you exactly what to expect with you in the long run. People often ask me, how long will it last? And it really depends on your body's metabolism, the type of filler or Botox that's injected, the areas that are treated. So there's no hard and fast rule on it. But generally, usually for lip fillers, I would say the first time it may only last 2 to 3 months as your body drinks up the filler a little bit and it all settles in naturally. Then after that you might be looking at 6 to 9 months or a little longer depending on the filler you have. But lifestyle factors certainly play a part in it. Sunbathing and sunbeds, a lot of exercise, and people with certain health problems or on medications that may affect the longevity of the treatment. But we would discuss that all with you at consultation. Botox treatments last about 3 to 4 months generally. People would love them to last longer, and I wish there was a magic key to that, but there isn't. But the good thing is, as it's wearing off, you can then decide whether you're going to do it again. It wears off so naturally and slowly that if finances don't allow you to have a treatment for a little while, that's all fine. You'll just return to looking exactly the way you were. We're not allowed to say Botox is a preventive medicine for wrinkles because it is a prescription medicine, but people will generally say it does seem to slow down the aging process and that they see some longer term improvement in the wrinkles even if they stop having treatment done for a short while. What if I don't like it? People ask me that. What if I have my lips done and I don't like them and I want to get rid of them and my husband hates them? I do get that as well. What I find with lip fillers particularly, and again it's one of the most emotive treatments because the mouth is a very personal area. People may message me the next day despite everything that I've warned them about the swelling and how they'll look and feel for a couple of weeks while they settle. They message saying, I think I've made a mistake, I need to have them dissolved, I really don't like them, my husband hates them, that does get said. And usually people are fine. We calm them down, we send them a picture of worse swelling than their own, and that actually makes them feel more assured that they're nothing different and everything is fine. It's good to know that other people have had that problem as well, and it's a totally normal part of lip filler healing. Some swelling is totally to be expected, and although I always warn clients, it can still be very scary and worrying when you wake up the next morning your lips are quite a lot more swollen, but it all settles down. And I've never ever had a patient say they had to dissolve them because they hated them, they didn't want them anymore. Usually everything is absolutely fine. But I always say, if that was to happen and you really didn't like them, lip filler can be dissolved. I don't like to do it. There's medical issues that arise with dissolving lip filler. It can damage the collagen in the lips. Also, there is a chance of allergic reaction to the dissolvent, but it is a possibility. So I always say nothing's permanent in facial aesthetics. I certainly don't use any permanent fillers at all. So there's always a way out if you're not happy with the treatment that you've received, but it never happens. Complications in facial aesthetics treatments and allergies to the treatments are often discussed. And clients can be quite worried about this, especially if they have an allergy already to certain things such as peanuts or other substances. Allergies to Botox and filler are extremely rare, but if you are a person who suffers a lot of allergies, we would need to know that before your treatment. We always take a full medical history, which helps us with any situation. We're medical professionals. If a problem occurs, we can deal with it, and that's really important. But allergy is extremely rare. If that happens, it can be addressed and your health won't be at risk. But don't worry too much about it. In the hands of a good medical professional, you will be safe.